Hello guys, welcome back to my YouTube channel. From this video, I'm going to discuss about the anatomy of facial nerve. So I would like to break up into subtopics as the nuclei of origin, then the cause of the facial nerve, and then the cauda tympani nerve, and then what happens when there is a facial nerve palsy, and how to differentiate whether it is upper motor neuron lesion and lower motor neuron lesion. So let's start our video. Um, facial nerve is the seventh cranial nerve, and it is the second. It is the nerve of the second branchial arch because it supplies all the muscles that develop from the mesodome of this arch. And the facial nerve is a mixed nerve. That means it has a large motor root and small sensory root. The sensory root carry taste sensations from the anterior two-thirds of the tongue and cutaneous sensations from the external ear. And also it carries uh, secretomotor fibers for submandibular gland, sublingual gland, as well as to the lacrimal gland. The sensory ganglion, which is also called as the geniculate ganglion, I will show you the geniculate ganglion in later in a picture, and it is located on the trunk in the intrapetrous part of the facial nerve. And functionally, this facial nerve is associated with submandibular gland and sphenopalatine ganglia. You have to remember that the functionally what are the ganglia this facial nerve is associated with. Those are submandibular ganglion and sphenopalatine ganglion. These are the four nuclei which the facial nerve arises. That means the motor nucleus of facial nerve, superior salivatory and lacrimatory nuclei, and nucleus of tractor solitarius, spinal nucleus, and tract of trigeminal nerve. Let's discuss this each of the nucleus separately. When we talk about the motor nucleus of the facial nerve, it lies in lower part of the pons medial to the spinal tract of spinal nucleus of trigeminal nerve. Uh, The corticonuclear connections of this motor nucleus of the facial nerve is very important. You can see the corticonuclear connections of the facial nerve nucleus in this diagram. And here is the facial nerve nucleus, and here are the corticonuclear fibers coming from the cerebral cortex. And you have the face, the upper part of the face and lower part of the face. This motor nucleus of the facial nerve can be divided into two as dorsal part and ventral part. You can see this dorsal part of the facial nerve nucleus receives corticonuclear fibers from the both sides. That means it receives bilateral corticonuclear fibers. And you can see the neurons in the dorsal group of the facial nerve nucleus supplies the muscles over the scalp and upper part of the face. This goes here. That means to the upper part of the face. And here is the ventral group of the ventral part of the facial nerve nucleus. You can see it receives corticonuclear fibers from the contralateral side, not from the same side. These are the contralateral corticonuclear fibers. Remember that ventral part of the facial nerve nucleus receives corticonuclear fibers from the contralateral side. So, but the neurons origin from this ventral group of ventral part of the facial nerve nucleus supplies muscles over lower half of the face. That means this area. This corticonuclear fiber connection is very important to differentiate where is the upper motor neuron lesion and lower motor neuron lesion according to the clinical features that patients presents. Then the second type of nucleus is superior salivatory nucleus. This is the superior salivatory nucleus, and it is divisible into two as salivatory nuclei and lacrimatory nuclei. You can see the accents of the superior salivatory nuclei and lacrimatory nuclei goes like this: general visceral efferents. I think this diagram is more clear to discuss that part. The lacrimatary nuclei here and superior salivary nuclei here. You can see the fibers origin from the lacrimatary nuclei goes like this and towards the lacrimal gland. And fibers origin from the superior salivary nuclei goes like this and towards this submandibular and sublingual salivary glands. Actually, this contains preganglionic parasympathetic fibers. This also contains preganglionic parasympathetic fibers to these glands. Then the third nuclei is the nucleus of Tractus solitarius. You can see the green color fibers are coming towards this nucleus. That means somatic visceral afferent fibers. So this nucleus of Tractus solitarius, is located in the medulla oblongata, and it is a sensory nucleus, and this receives fibers from the anterior two-third of the tongue. That means taste sensations, taste sensory fibers receives to this nucleus of Tractus solitarius. And then here is the spinal nucleus and tract of trigeminal nerve. So this receives, you can see these yellow color fibers are coming towards this nuclei, and it receives general somatic afferent fibers, and those fibers are cutaneous fibers from the external ear. Those are the four types of nuclei which gives rise to this facial nerve or the seventh cranial nerve. Hope you clearly understood these four types of nuclei. Now we will see about the intrapontine course of the facial nerve. Here you can see main fibers of the facial nerve. The fibers from the motor nucleus of the facial nerve goes like this around this abducens nerve nucleus. It takes a sharp bend around this abducens nerve nucleus. Because of this sharp bend, we call it as internal genu of the facial nerve. And because of this internal genu, you can see an elevation formed, and this elevation is called as facial colliculus. This is on the floor of fourth ventricle. The fibers of the motor nucleus leaves pons in between spinal nucleus and tract of trigeminal nerve and facial nerve nucleus. It goes in between those two nuclei. Then this facial nerve emerge from the pontomedullary junction. Actually, from the lateral aspect of the pontomedullary junction, this facial nerve emerges, both the motor root and the sensory roots. Let's see how the facial nerve goes through the posterior cranial fossa. This is the facial nerve coming from the which emerge from the pontomedullary junction, and this is the internal acoustic meatus, and this is the greater petrosal nerve. This is the fibers to the lacrimal gland, and this is the facial nerve. This is the geniculate ganglion, and here it is in the facial canal. In the facial canal, it gives a branch as nerve to stapedius, and then this is the coda tympani branch of the lingual nerve, which connects to this lingual nerve, and here is the stylomastoid foramen, and you can see after this stylomastoid foramen it gives some fibers posterior auricular nerve, then digastric branch to the posterior belly of digastric muscle, then stylohyoid branch, and then to the muscles of the face. Here the facial nerve goes through this first enter into this internal acoustic meatus, both the motor root and sensory root, with labyrinthine artery and vestibulocochlear nerve. You have to remember that what structures goes through this internal acoustic meatus. Those are the facial nerve, vestibulocochlear nerve, and labyrinthine artery. Those three structures you have to remember well. Then intrapetrous course of the facial nerve. In intrapetrous course of the facial nerve, it divides into two parts as meatal and facial. In the facial canal, meatal part is in the internal acoustic meatus, where the motor root is lodged in a groove on the antero-inferior surface of the vestibulocochlear nerve, but the sensory root separates them. At the bottom of the internal acoustic meatus, the two roots unite and form the trunk of the facial nerve, and then facial nerve enters into the facial canal. So in the facial canal, it divides into three segments. The course of the facial nerve divides into three segments. These are the three segments. The first part is the labyrinthine segment. It passes laterally above the vestibule of the inner ear to reach the anterior end of the medial wall of the middle ear. Here it bends backward at a sharp turn called external genu of the facial nerve, which is called as the geniculate ganglion lies in this labyrinthine segment. That means this geniculate ganglion is in the external genu of the facial nerve. I discussed about the internal genu when I show you the intrapontine course of the facial nerve. So this at the external genu you have the geniculate ganglion. Then the second part or the second segment is the tympanic part. It passes backwards in the medial part of the middle ear till it reaches the posterior end of this wall. The second part is also known as the horizontal part. This is the tympanic part or the second part of the part in the facial canal. This is the third part in the facial canal or the mastoid segment. We call it as vertical segment as well because it lies as vertically. It begins at the posterior end of the medial wall and passes downwards in relation to the posterior wall of the middle ear and reach stylomastoid foramen. So, these three parts, labyrinthine part, tympanic part and mastoid part, these three segments lie in the facial canal. When we talk about this geniculate ganglion, it is a sensory ganglion on the facial nerve located at the external genu in the facial canal, and it contains pseudo-unipolar neurons. The peripheral process of the neurons brings sensations of taste via coda tympani branch of the facial nerve and general sensations from the auricle via communicating branch of the facial nerve to the auricular branch of vagus. Central processes of ganglion cells are carried to the brain stem by nervus intermedius. I'll show you nervus intermedius in a later picture. Then central processes carrying taste sensations terminate on the nucleus of tractus solitarius, and those carrying cutaneous sensations terminate on the spinal nucleus, as I discussed previously. And also, this geniculate ganglion receives preganglionic parasympathetic fibers via nervus intermedius. These fibers pass out from the ganglion in the greater petrosal nerve. In this diagram, I will show you the sphenopalatine ganglion or the pterygopalatine ganglion and the connections with this facial nerve. This is the lacrimal gland, pterygopalatine or sphenopalatine ganglion nerve of the pterygoid canal and greater petrosal nerve. So, the geniculate ganglion receives preganglionic parasympathetic fibers via nervus intermedius. These fibers pass out from this ganglion via the greater petrosal nerve, and this greater petrosal nerve joins with the deep petrosal nerve and forms a nerve of the pterygoid canal. This is the nerve of the pterygoid canal. The nerve of the pterygoid canal brings preganglionic parasympathetic fibers to the sphenopalatine ganglion. These contain preganglionic parasympathetic fibers, but deep petrosal nerve contains sympathetic fibers. So the nerve of the pterygoid canal brings preganglionic parasympathetic fibers to the pterygopalatine or spinopalatine ganglion. Geniculate ganglion also receives external petrosal nerve, which brings sympathetic plexus around the middle meningeal artery. Let's see what are the branches um, arises in the facial canal. There are three branches. There is a communicating branch which gives to the auricular branch of the vagus nerve. Then nerve to stapedius. This is the nerve to stapedius muscle, and it arises at the junction of the horizontal and vertical segments. This is the junction between, this is the vertical part and this is the horizontal part. Nerve to stapedius arises at the junction between vertical and horizontal parts in the facial canal. And finally, the third branch is the chorda tympani nerve. It arises from the vertical segment of the facial nerve in the facial canal 6 millimeters above the stylomastoid foramen. So, chorda tympani nerve gives before it leaves through this stylomastoid foramen. Once the facial nerve leaves through this stylomastoid foramen, it gives muscular fibers as a posterior auricular nerve, digastric branch, and stylohyoid branch. So these are to the stylohyoid muscle, then posterior belly of digastric muscle, then occipital belly of the occipitofrontalis muscle by posterior auricular nerve. And then it gives 5 branches to the muscles of facial expression and platysma. So these are the branches, temporal branch, and then zygomatic branch to here, and then buccal branch, then mandibular branch, then cervical branch. This is the branch to the occipital belly of the occipitofrontalis muscle. When we discuss about this chorda tympani nerve, the branch of the facial nerve, and it is a mixed nerve actually, as it carries taste sensations from anterior two-thirds of the tongue and secretomotor fibers to the submandibular gland and sublingual glands. As I told you, it arises from the vertical part of the facial nerve in the facial canal about 6 millimeters above the stylomastoid foramen. This chorda tympani nerve first travels inside the tympanic membrane on a lateral wall of the middle ear. On its way anteriorly, it crosses the handle of the malleus. At the anterior margin of the tympanic membrane, it enters into a bony canal called anterior colliculus, which opens into petrotympanic suture. After coming out of this suture, it enters into the infratemporal fossa to meet the lingual nerve. This chorda tympani branch then meet the lingual nerve at the acute angle. At an acute angle, actually there should be an acute angle here. On its way to the lingual nerve, the chorda tympani nerve crosses medial to the spine of the sphenoid bone. You have to remember that point. It crosses medial to the spine of the sphenoid bone. As the lingual nerve passes through the submandibular region, it gives branch to the submandibular ganglion, and then this branch contains preganglionic parasympathetic fibers to the fibers which coming from the superior salivary nucleus. Then from this submandibular ganglion, it gives off postganglionic parasympathetic fibers to the submandibular as well as sublingual salivary glands. Now you can summarize the whole course of the facial nerve from this diagram. Here the pons, midbrain and medulla oblongata here. So here is the lateral aspect of the pontomedullary junction. Facial nerve emerges as mode separately, motor root and the sensory root. And After it enters into the internal acoustic meatus here, it joins together and forms one nerve called facial nerve, and then here in this area there is a geniculate ganglion at the external genu. When it enters into the facial canal, here is the total course over in the facial canal. After about here, the external acoustic it is in the internal acoustic meatus, and then in this part is in the facial canal. So the labyrinthine part or in this area, external genu contain geniculate ganglion, and this area greater petrosal nerve connects with this deep petrosal nerve and forms the nerve of the pterygoid canal. Via this, the parasympathetic fibers goes to this lacrimal gland through this pterygopalatine ganglion. When this further the facial nerve is in the facial canal, um, it gives off nerve to stapedius muscle, the second branch, and the third branch is the chorda tympani nerve. The chorda tympani nerve goes and joins with this lingual nerve and carry preganglionic parasympathetic fibers to the submandibular salivary gland, and from this submandibular salivary ganglion, from this ganglion it gives postganglionic parasympathetic fibers to the submandibular gland and sublingual gland. Then facial nerve leaves the facial canal and exit from the cranium through stylomastoid foramen and gives muscular branches. Posterior auricular nerve supplies occipital belly of occipitofrontalis muscle, and then nerve to posterior belly of digastric muscle, then nerve to stylohyoid muscle. There are three muscles which supplied after it leaves through this stylomastoid foramen. Then further it goes in front or the anterior aspect of the face and gives five branches. It is in here in this area. It is in the parotid gland, and it gives five terminal branches as temporal branch, zygomatic branch, buccal branch, mandibular and cervical branch. Those are the five terminal branches which innervates the muscles of facial expression. Finally, we will discuss about the facial nerve palsy. How to differentiate upper motor neuron lesion and lower motor neuron lesion. Here, upper motor neuron lesion means if there is a lesion occur in the fibers before coming to this facial nerve nucleus. That means if there is a lesion in the supranuclear fibers. The most common cause of supranuclear lesion or the upper motor neuron paralysis is hemorrhage in the internal capsule involving corticonuclear fibers. This results in contralateral paralysis of the lower face and contralateral hemiplegia. If there is a upper motor neuron lesion, there is paralysis of lower face in this area. This is the upper motor neuron lesion, only lower part, contralateral lower part is affected. Contralateral lower part is affected. Remember that if there is a lesion in the left side, the upper motor neurons in the left side, the lesion occur, upper motor neuron lesion occur, the patient presents as lower part of the right-sided face. Then the next type is nuclear lesions and infranuclear lesions. Both nuclear lesions and infranuclear lesions taken as lower motor neuron lesions. In the nuclear lesions, the most common cause is vascular accidents in the pons. The effects are ipsilateral lower motor neuron facial paralysis involving entire face. The same site lesion, that means lower motor neuron lesion. When the pontine lesion includes corticospinal fibers and facial nucleus, it gives rise to Millard-Kupler syndrome. That means ipsilateral facial paralysis and contralateral hemiplegia. When we talk about the intranuclear lesions, that means it involves facial nerve beyond its attachment to brainstem. This causes complete facial palsy on the side of the lesion, on the same side. Here, the lesion has been occurring in the left side, and the patient presents as left-sided lesion. These intranuclear lesions can be anywhere in the course of the facial nerve after the it leaves from the brain stem. That means a lesion can be in the cerebellopontine angle or internal acoustic meatus, and sometimes lesion can be in the external genu involving geniculate ganglion, or sometimes the lesion can be in the medial wall of the middle ear, which give rise to ipsilateral facial paralysis. And sometimes lesion can be in the facial canal, or sometimes lesion can be in the stylomastoid foramen, like that, anywhere in the facial nerve course or the facial nerve pathway after it emerged from the pontous medullary junction. There is a condition called Bell's palsy, and the Bell's palsy also we called when there is a lesion in the lesion of the facial nerve in the stylomastoid foramen, resulting in ipsilateral facial nerve paralysis. In the Bell's palsy is also a synonym with idiopathic facial palsy. In Bell's palsy, there is loss of horizontal wrinkles. There is loss of horizontal wrinkles of the forehead, inability to close the eye, epipora, loss of corneal reflexes, absence of nasolabial fold here, and inability to show teeth. You can see the sagging of the corner of the mouth or the drooping of the corner of the mouth, like symptom, like presentation. This is the presentation of Bell's palsy, or this is a presentation of a lower motor neuron lesion of the facial nerve. Hope you are clear with this comparison of the upper motor neuron lesion and lower motor neuron lesion of the facial nerve. And hope you are clear with this all the pathway and the branches of the facial nerve. And if you understood well, if you like this video, please put a like and put a comment, and please subscribe into my channel for more videos. Thank you for watching.